Guys, of the cash flow series that we're doing, this one is about case acceptance and how that affects your cash flow. Case acceptance, as doctors, hygienists, all of you all know, is the biggest area of growth within your practice. So question for everybody that's presenting treatment. Are you getting consistent yeses because of the value that you're adding during what you're saying? And if not, how can we at AMP help you? We're all trained coaches to help you get to the yes by perhaps saying something different. For this case presentation and acceptance dialogue, I'd like to give you a couple of scenarios. They were real life things that happened to me. So sharing it with you to give you an idea of how we approach case acceptance. I'm in an office in Nebraska and the doctor is presenting treatment and I walk by the room and I stop to listen. And what I heard was, I looked at the x-rays and saw a bunch of treatment to be talked about. And what the doctor proposed is an MODBL, I call it a QRST because it was a gigantic filling, on number 2. And when he got done, I said, can you help me understand how you got to that diagnosis? And he said, his words were, he's my friend, he's a farmer, he doesn't have any money, that's all we're going to do. And I said, no worries. Do you have anybody else today that you're going to talk about? He said, yes, actually the next patient's kind of like this one. And I said, so maybe the same diagnosis? He said, yeah, a filling or 2. And I said, okay, could we coach you? And he said, of course. So we went into a room with the x-rays, and I can't read x-rays, but I know what they look like. And he pulled the x-rays up, and I saw a lot of dentistry to be done. And I asked the doctor what his approach was. And he went into the whole story of, well, he's a farmer and he doesn't have a lot of money and we're just going to do a tooth or 2 at a time. I said, good enough. May I coach you? And he said, of course. And I said, I'm going to make pretend. I got my magic wand out. I don't have it out here. Sorry. Got my magic wand out and I said, I'd like for you to pretend that this is utopia, doc. And he's looking at me a little funny. And I said, the only thing available to you is the finest of tools, the finest of products, and this is your dad. What would you present? And that doctor went from this to this real fast, and he said, 9 crowns. I said, good. May I coach you to go in that room, offer that patient 9 crowns, and totally accept no, but pretend he's your dad. And the doctor went in there and he was very nervous, and the patient said yes to treatment, and the doctor approached me back and said, that was way too easy. So if you take a look at what just happened, we took him from a mindset of the story he tells himself. If you don't know what that is, ask your coach. The story that he was telling himself is, I'm going to judge this person's pocketbook and do lesser treatment because they can't afford it, when in reality that lesser treatment may cause them more money in the future, versus offering them to do the best today to save the most money for tomorrow. The doctor did it, the patient accepted, and the doctor continued to do that. Scenario number 2, same office, younger doctor. Patient came in, 32 years old. 2 years ago, this doctor took these molars out at the age of 30. Hadn't seen the patient since. Abscess here, both molars. I said to the doc, hey, what's your plan? He said, I'm going to take both teeth out. I said, are you going to offer him anything else? He said, no, I took his teeth out last time. And I said, you know, he's 32. Is there anything else we can offer him? And he said, no. So in coaching with the doctor, I said, would you be willing to sit with him eye to eye, knee to knee, and just look at him and go, hey, how are you chewing over here? And the doctor looked at me and said, well, I know he's not chewing over there. I said, I know. Let him tell you that. So the doctor went in there and said, hey, I know you have problems here, but how are you chewing over here? And the patient looked at him and said, hey, doc, I can't chew over here and I don't want to lose any more teeth. That patient left that day fixing this and adding implants. So case presentation dialogue is something that AMP specializes in. It will dramatically change your cash flow. We can't tell you how to do your dentistry. We're not qualified to do that, but we are very qualified to listen to what we hear, change the words of what you say to get your treatment acceptance. Docs, hygienists, front desk, work with your coach, perhaps at a team training time at lunchtime, and find out how to do this. It is a blast, a ton of fun, and watch your doctor change when he gets those continuous yeses. Good luck.